In this video, we are going to study about the ligaments and the muscles of the larynx. First, we'll see about the ligaments. The ligaments are classified into extrinsic ligaments and intrinsic ligaments. First, we'll see about the extrinsic ligament. So, first one is the thyrohyoid membrane. So, this is the thyrohyoid membrane. So, this connects the thyroid cartilage to the hyoid bone. Its median and the lateral part are thickened to form the median and the lateral thyrohyoid ligament. The membrane is pierced by the internal laryngeal nerve and the superior laryngeal vessels. The next extrinsic ligament we'll see is the hyoepiglottic ligament. So this ligament connects the upper end of the epiglottis to the hyoid bone. The next extrinsic ligament is the cricotracheal ligament. So this connects the cricoid cartilage to the upper end of the trachea. Next we'll see about the intrinsic ligament. The intrinsic ligaments are a part of a broad sheet of fibroelastic tissue known as the fibroelastic membrane of the larynx. This membrane is placed just outside the mucosa of the larynx. So this is a mucosa. Outside the mucosa you have the fibroelastic membrane of the larynx. So this fibroelastic membrane is interrupted by the sinus of the larynx. So this is the sinus which interrupts the fibroelastic membrane of the larynx. So the part of the membrane above the sinus is known as the quadrate membrane. So this is the quadrate membrane. The part below the sinus is the cricoacal membrane or conus elasticus. Cricoacal membrane or conus elasticus. The quadrate membrane extends from the arytenoid cartilage to the epiglottis. It has an upper free border which forms the aryepiglottic fold and the lower free border which forms the vestibular fold. So the upper free border of the quadrate membrane forms the aryepiglottic fold and the lower free border of the quadrate membrane forms the vestibular fold. Likewise, the conus elasticus or the cricoacal membrane extends upward and medially from the arch of the cricoid cartilage. The anterior part is thick and it is known as the cricothyroid ligament. The upper free border of the conus elasticus forms the ocal fold. So this is the ocal fold. So now we'll see about the muscles of the larynx. First we'll see about the extrinsic muscles of the larynx. So the extrinsic muscle of the larynx are formed by the suprahyoid and the infrahyoid muscles of the neck. So this includes the mylohyoid muscle, the anterior belly and the posterior belly of the digastric muscle. Then you have the stylohyoid muscle and then you have the superior belly of the omohyoid muscle, then the sternohyoid muscle, then the sternothyroid muscle and the thyrohyoid muscle. So all the suprahyoid and the infrahyoid muscles forms the extrinsic muscles of the larynx. Now we'll see the intrinsic muscle of the larynx. So first we'll see about the cricothyroid muscle. The cricothyroid muscle is the only muscle which is present outside the larynx. So now we'll see the parts. So you have a straight part and another one is the oblique part. When you see the origin, it takes origin from the lower border and the lateral surface of the cricoid cartilage and the fibers passes upwards and backwards and gets inserted to the inferior carnua and the lower border of the thyroid cartilage. The next muscle we'll see is the posterior cricoarytenoid muscle. So this muscle is a triangular muscle, takes origin from the posterior surface of the lamina of the cricoid cartilage and the fibers passes upwards and laterally gets inserted to the posterior aspect of the muscular process of the arytenoid cartilage. The next muscle we'll see is the lateral cricoarytenoid muscle. So it takes origin from the lateral part of the upper border of the arch of the cricoid cartilage, and the fibers passes upward and backward and gets inserted to the anterior aspect of the muscular process of the arytenoid cartilage. Next we'll see about the transverse arytenoid muscle. So the transverse arytenoid muscle is the only unpaired muscle of the larynx. So it takes origin from the posterior surface of one arytenoid, and the fibers passes transversely and inserted to the posterior surface of the another arytenoid cartilage. So next we'll see about the oblique arytenoid muscle. So the oblique arytenoid muscle takes origin from the muscular process of one arytenoid cartilage, and the fibers passes obliquely and gets inserted to the apex of the another arytenoid cartilage. Some of the fibers are continued as the aryepiglottic muscle on the edge of the epiglottis. So this oblique arytenoid muscle continues along the edge of the epiglottis as aryepiglottic muscle. Next we'll see about the aryepiglottic muscle. So the aryepiglottic muscle is nothing but some of the fibers of the oblique arytenoid muscle. They extend upwards along the aryepiglottic fold and gets inserted to the edges of the epiglottis. So this forms the aryepiglottic muscle. Next we'll see about the thyroarytenoid muscle. So this is the thyroarytenoid muscle. So when you see the thyroarytenoid muscle, it takes origin from the thyroid angle. So I have removed the thyroid cartilage. So here you will get the thyroid angle. It takes origin from the thyroid angle and the adjacent cricothyroid ligament. The fibers runs backwards and upwards and gets inserted to the anterolateral surface of the arytenoid cartilage, and some of the fibers of the upper fibers forms the thyroarytenoid part. So this is the thyroarytenoid part which runs upward into the aryepiglottic fold to reach the edge of the epiglottis, and this forms the thyroepiglottic muscle. The next muscle we'll see is the ocalis muscle. So the ocalis muscle takes origin from the ocal process of the arytenoid cartilage. They pass forward and gets inserted to the ocal ligament and the thyroid angle. Next we'll see the nerve supply. All the intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid muscle, which is supplied by the external laryngeal nerve. Now we'll see the actions of the intrinsic muscles of the larynx. So this is the muscular process of the arytenoid cartilage, and this is the ocal process of the arytenoid cartilage. Any muscle which pulls the muscular process medially pushes the ocal process laterally, so resulting in abduction of the ocal cord. So this is the abduction of the ocal cord. So this is done by one pair of muscle, that is the posterior cricoarytenoid muscle. The muscles which pull the muscular process forward and laterally will push the ocal process medially, causing the adduction of the ocal cord. So this is done by the lateral cricoarytenoid muscle and the transverse arytenoid muscle. Next we'll see about the cricothyroid muscle. So this is the cricothyroid muscle and this is the cricothyroid joint. The cricothyroid causes a rocking movement of the thyroid cartilage forwards and downwards at the cricothyroid joints. So it tenses and lengthens the ocal cord. The thyroarytenoid muscle and the ocalis muscle pulls the arytenoid cartilage forward, and this causes a relaxing of the ocal cord. Now we'll see the movements which are produced by the muscles. Elevation of the larynx is produced by the thyrohyoid muscle and the mylohyoid muscle. The depression of the larynx is produced by the sternothyroid muscle and the sternohyoid muscle. The opening of the inlet of the larynx is produced by the thyroepiglottic muscle. The closing of the inlet of the larynx is produced by the aryepiglottic muscle. The abductor of the vocal cord is produced by the posterior cricoarytenoid muscle only. The adductor of the vocal cord is produced by the lateral cricoarytenoid, transverse arytenoid and the oblique arytenoid muscle. The tensor of the vocal cord is produced by the cricothyroid muscle. The relaxer of the vocal cord is by the thyroarytenoid and the vocalis muscle. The posterior cricoarytenoid, which is the only abductor of the vocal cord, is also known as the safety muscle of the larynx.